This is Wendy Hoffman's teaching video for N215 spring of 2025. Hi, Mr. Hoffman. Hi, Mrs. Hoffman. My name is Wendy. I'm going to go over your medication teaching today. I know a lot of nurses have been in and out the last few days getting you ready for discharge. I'm just going to go over what your medications are going to be whenever you leave us.
Okay.
So you have been taking Synthroid 100 micrograms daily for your hypothyroidism, correct?
Right.
Okay, so that dose has not changed. You're going to take that in the morning, every morning, preferably like 30 minutes before breakfast.
Okay.
And then your Protonix 40 milligrams daily for your acid reflux. That dose has not changed either. You're going to want to take that daily with or without meds. And then you're going to have 3 new medications that I'm going to go over next.
Okay.
Here is a copy of your new meds and everything I'm going to go over. If you have any questions, just stop me. So the first one is going to be metformin. You're going to take 500 milligrams of that daily.
Okay.
This is for your diabetes. You're going to want to try to take it at the same time every day. If you forget a dose, don't double doses, just take it the next scheduled dose time.
Okay.
The most common side effects are GI upset, diarrhea, maybe feeling nauseous. It usually passes once your body gets used to taking this med, but if it, usually taking it with food helps. If you're still not feeling so hot taking it, notify your doctor and discuss it with him.
Okay.
You might just need a med or dose adjustment. You're gonna want to follow up with your regular doctor's visits to track your progress and to monitor your blood sugar over time.
Okay.
I know a few nurses have been in and out discussing your taking Accu-Checks. Are you comfortable with that?
Mm-hmm.
Okay, great. Well, taking this med, you're going to want to know the signs and symptoms of hypoglycemia. So if your blood sugar gets too low, you'll feel shaky, anxious, sweaty, dizzy. Usually this is if you forget to eat or you're not feeling so hot and haven't eaten in a while and haven't taken enough in.
Okay.
You can take a snack, drink some fruit juice. That usually brings it back up. The other end of the spectrum is too high of a blood sugar, and that would be the symptoms you had when you came into our ED. So if you're increased thirst, urination, tired, you're going to want to notify your doctor and probably have your meds adjusted.
Okay.
You're not allowed to drink alcohol in this med, so no partying. You're going to want to follow the instructions from the nutritionist regarding your diet, and that was all gone over with you before.
Mm-hmm.
One of the things with this med is if you have a CT scan with dye or are scheduled for surgery, you're going to want to discuss or notify the medical personnel that you're on this med, because they prefer you to stop at 48 hours before you have any kind of scans that involve contrast.
Okay.
I'm going to go over your 2 blood pressure meds. They both work on blood pressure to lower it. They just work 2 different ways on your body. The first one is low pressure. You're going to want to take 50 milligrams a day.
Okay.
You can take this before meals, same time every day. Don't double dose it. Don't double dose if you miss a dose. Just take your next regularly scheduled time.
Okay.
The most common side effects is feeling dizzy or lightheaded from sitting to standing.
This is my emotional support dog.
Okay. So if you're getting from laying to sitting or sitting to standing, you're going to want to just try to get up slowly. If you feel dizzy or faint, sit back down, take a breath.
Okay.
This is just till your body gets used to having a lower blood pressure. If you have upset stomach, stick to simple food. No rich food, spicy food. If you get a headache, drink extra water. But if a headache persists, you're going to want to talk to your doctor about it.
Okay.
Some of the side effects to tell your doctor about right away is if you get severe dizziness or pass out, probably means your blood pressure's too low, and your dose will need adjusting.
Okay.
If you have any new onset chest pain, or feel like your heart's skipping a beat, you'll want to mention that to your doctor.
Okay.
If you get short of breath or have any swellings in your arms and legs, that's another thing you'll want to discuss with him. As previously instructed, you're going to want to talk to your doctor before taking any over-the-counter meds. So this is like cold and cough meds, diet pills, stimulants, or NSAIDs. So if you take Motrin ibuprofen, you're going to want to talk to your doctor before you take any of those.
Okay.
This is not a med you can stop just willy-nilly. It's preferred that you taper off of it. So if you are having any side effects that you don't like, just talk to your doctor and discuss it with him before you stop taking this med.
Okay.
Keep regular doctor's appointments to monitor your blood pressure and dose adjustments, and monitor your blood pressure and heart rate, like we discussed earlier, or they discussed with you earlier about your hypertension diagnosis.
Okay.
Your next med is going to be Zestrol. It's going to be 10 milligrams daily. The most common side effect with this is the same as I described with low pressure. So the feeling lightheaded or dizzy with position changes, if you get an upset stomach or a headache, you know what to do. The big thing with this med is if you get a dry, irritating cough, you're going to want to notify your doctor. Probably means you need to switch to a different kind of med. It's just a common side effect of this type of medication.
Okay.
You're also going to want to follow up with your doctor regarding liver and kidney function. So whenever you have follow-ups, they might request blood work to check your liver and kidneys.
Okay.
You're going to want to immediately report any signs: shortness of breath, facial swelling, tongue swelling. You take these once daily with or without food, and don't skip a dose. Take it the next scheduled dose.
Okay.
You talked to our nutritionist already regarding diet for diabetes and hypertension, but with this med, you probably should keep your sodium intake below 1,500 milligrams.
Okay.
And she gave you a handout regarding decreasing your sodium intake, correct?
Right.
Okay. Also want to talk to your doctor before you take any over-the-counter medications with this one that might increase your blood pressure. And with all of your meds, you're going to want to take them every day, even if you're feeling better. With diabetes and hypertension, if you're feeling better on your medications, it means they're working, so you're going to want to take them unless otherwise told to you by your doctor.
Okay.
With both these diagnoses, you should get more active. You don't have to go do a triathlon or anything crazy. Just simply getting out, getting active, trying to walk daily is a good start.
Okay.
And right here we have your follow-up appointment with your family doctor, Schmagegi, at Friday at 10. That'll be on your discharge paperwork too, but we already have it set up for you, so you're good to go, and you can discuss anything you need to with him after you leave here.
Okay.
Do you have any questions for me?
No, ma'am.
Okay, well, it was nice meeting you and having your stay with us, and I hope everything goes great after you leave.
Thank you.
Thanks, bye.
Have a good day.